Good morning. Welcome to Speaking of Animals. I'm Amy Carotenuto from Flagler Humane Society. I have two wonderful guests today, one doctor guest and one feline guest. So our doctor guest is Dr. Tierney Whalen from Flagler Animal Hospital. Yay, big round of applause. And our cat guest, our feline co-host, if you will, is Spencer. Spencer is a gorgeous white cat, kind of a squishy face, maybe a little Persian in there. He's about 3 years old, and he came to us as a stray. Spencer has a microchip, which usually is the pet's ticket home, yay, but his microchip's not traceable. So maybe if anybody's watching on YouTube, they may recognize Spencer, and maybe we can help get him back home. If he doesn't go home, though, he's going to be up for adoption. He's super, super nice. That's why I brought him today, because he's just like the mellowest, easiest going cat ever, and keeps his little living quarters nice and clean, and seems to be healthy. So he's a good boy, and hopefully will go home, but in lieu of that, hopefully get adopted. So sorry for giving you second billing there, Dr. Whalen, but
no worries.
So Dr. Whalen, I know you went to University of Florida. Yay, go
Ooh,
Gators.
you know stuff about me.
Yeah,
Yes.
we've been
Go
stalking you. So yeah, I think everybody loves the Gators, right? So
except for
except for those that don't.
SEC fans, yeah.
So, but with you at Flagler Animal Hospital, you and the other doctors at Flagler Animal Hospital do some amazing work for all the animals, but for us, I know for a fact you guys have just been awesome and life-saving, and the long list of animals that you have helped Flagler Humane Society with. So thank you to you and all the amazing staff at Flagler Animal Hospital.
Thank you. That's so kind.
I know one of the things that you've helped us with, and I think is something that has been near and dear to your heart, has been helping diabetic cats.
Yes, and there's some new products we wanted to talk about today.
Yes.
First, do you want to do a little rundown about what diabetes is?
Oh, that'd be perfect. Yes.
Let's start at the basics. So diabetes is fairly common in cats. It's something I do diagnose on a regular basis. And basically what it it has everything to do with the pancreas. The pancreas produces a chemical called insulin that our bodies need in order to use the sugar that we consume. I like to think about insulin almost like a key to a lock. If you think about sugar circulating in your bloodstream, in order for your tissues to actually absorb it and use it, you need insulin. Insulin unlocks the door so the tissues can use the sugar. And so what our cats deal with, and dogs sometimes too, is they don't produce enough insulin, or their pancreas becomes insulin resistant. And when that happens, they have all this sugar circulating in their bloodstream, but they just can't use it. And so historically, what we've done to treat it is we've used insulin injections, just like you do if you're a human with diabetes. But there's a lot of issues that come with injections with cats and dogs. They're not always willing participants in their treatment. And so what I wanted to talk about today is some of the new alternatives out there. Now, these are only available for cats. So that's really important to know. This is not appropriate for your dog. But for many newly diagnosed cats, these drugs are changing the game. So as far as I know, they come in kind of two forms. There's one that's a tablet and one that is a liquid. I tend to prefer the liquid for cats because I think most clients do, but that's a whole nother conversation. And the other nice thing is they're only administered once a day.
Very nice.
Far easier than twice daily insulin injections. And honestly, the monitoring and regulation that has to occur with insulin is far less with these oral products.
Nice.
Now, there is quite a bit of monitoring that's required in the beginning. And that's the big problem with these drugs, is they're not for every single cat. And so when we first start them, we do have to check some blood work values, usually the first 2 to 3 days after we start it. Then a week later, and then a lot of times we'll do a couple weeks, month later after that. And if everything's going well at that point, really the monitoring becomes very minimal as long as your cat is staying healthy. So it's really just changing how we are able to treat these guys. And there's a lot of clients out there who previously would not have been comfortable with insulin injections, but are comfortable giving these medications.
That could be life-saving. I know we have cats brought into the Humane Society, and sometimes it's
Surrendered.
simply just, the doing the injections and the monitoring and everything is just too much for people. It's too
Yeah.
stressed, for it's
It is. It's
stressful.
stressful too.
It's scary
Yeah.
for them to give injections to the cat. And
If you
so
go out of
this,
town, you have to have someone else do it for you. And if you mess up your insulin injection, you can cause a lot of bad problems with these oral medications. Once the original risk is overcome and we know they're going to tolerate the drug well, there's really very little risk after that. They do really, really well.
wow,
So.
wow. And also too, with diabetes in cats, I guess it's good to remind people like that doesn't, if you get a cat that is diagnosed with diabetes, that doesn't mean it's going to be forever.
Not always.
Like
No.
with humans, it's usually forever, I guess.
Yes,
But
unfortunately.
for cats, that's the good news is what if it is just a temporary thing and people are giving up their pets for that? But
You're right.
this,
Remission is possible with cats, not with dogs. But with cats, yeah, I've had quite a few cats go into remission
Really?
with diet and with appropriate therapy. Yeah.
how long have you been using this new?
This new product, I've probably been using it for the last 6 months or so. I believe I've
Okay.
started about 5 cats on it. And I've been very lucky because all of the cats that I've started on it have tolerated it. And so they're still on the drug to this day. And as far as I know, they're all doing really, really well.
Very good. Are there any risks I'm sure
Yeah,
there's some.
so
But
the biggest risk is those first couple weeks. Really, the first 2 weeks is the biggest risk. And there is a risk that they go into diabetic ketoacidosis, which it's a very serious problem. It would require usually hospitalization for a couple of days, which can be very expensive. But it's rare that cats have this reaction. And with if they're coming in for the monitoring that we recommend, usually we can catch it early and get them back on insulin if we have to. Now, again, I've been lucky and I haven't needed to do that yet. But I'm sure one of these days I'll meet a cat who's not a good patient.
yeah. Well, hopefully not. Hopefully it keeps going this well, and maybe someday you think, I don't know. I know you don't have a crystal ball, but someday you think there'll be a version of this for dogs, probably.
I hope so. I really hope so. But I am not a pharmacologist, so I cannot speak on what's in the works. But it would be a wonderful alternative for dogs if it were possible.
For sure. And I guess, like you say, we don't see as many diabetic dogs, but I'm sure you've seen some.
Quite a few, yeah.
Yeah.
It just diabetes is a little different in dogs. They're just not candidates for this drug yet.
Hopefully a version of it sometime soon. So tell us some of the other things. I know you say that you like to help with emergency cases, which I'm sure everybody who has ever had an emergency with their pet will appreciate having a doctor who's willing to see you during an emergency and interested in helping, and that's very much appreciated.
Yeah. Well, at Flagler Animal Hospital, we are really lucky that we have quite a few doctors on staff. So we try our best to always have a general practice doctor seeing wellness appointments, as well as a emergency urgent care doctor seeing same day emergency appointments. So I do want everyone in the community to know that even if you use a different veterinarian, if you're in need of emergency care during the day, please call Flagler Animal Hospital. We leave a whole schedule of appointments open every day for these types of emergencies. Now we're not open after hours. We close at 7, but prior to 7, we're ready. We'll take whatever comes at us. So
That's very much appreciated.
yeah, I think it's needed in this community. So it's nice we're able to offer that.
For sure. So, all right. Well, we're going to take a quick break and we will be right back. Welcome back to Speaking of Animals. I'm Amy Carotenuto here with Scooter and Dr. Whalen. Sorry, we put Scooter first. So
He's cuter.
Scooter is enjoying his 15 minutes of fame here, I think.
He's a ham.
Yes. So before we took a break, Dr. Whalen, we were talking about how Flagler Animal Hospital responds to emergencies. And I've got to tell you this, not real recently, but the story that will stay in my mind forever was a case where we got our dispatch got a call about a neighborhood house where they could hear a dog fight going on inside. People were at work, but the dogs had gotten to each other in the backyard, and we could hear the fight going on. And so we like trucked it out there. We got there as quickly as we could. By the time we got to the property, the fight had, the fight had ended, but there was one dog severely injured, a red Doberman, and we scooped him up and we rushed him straight to Flagler Animal Hospital, and they came running out. I mean, it was just like in the movies.
Yep.
But this poor dog was crying like I'll never forget the sound of his cries. And, your staff came out, grabbed him, and he was in the hospital with you. I can't remember how many days, but healed up 100%.
Yeah.
Completely.
They do heal quick.
Oh my gosh, he did so well. And one of my favorite volunteers adopted him, and he is living the life now. So thank goodness though that y'all were available to do that, because I don't think he would have made it.
No, I'm glad we could be there for you guys.
Yes. So yay, Flagler Animal Hospital. So I know one thing that we all see this time of year, hopefully not bad enough that it's an emergency situation, but we all see this time of year a lot of upper respiratory infections. Right?
Oh, it's so common. I think I saw 3 yesterday alone. Very common in cats, especially if they have been in a shelter scenario. It's not the shelter's fault. It's just when you have a lot of cats in close proximity.
Like kids in kindergarten.
Like kids in kindergarten, exactly. Like my son in kindergarten. We're sick every other week, it seems like. And just like in kids, the symptoms are actually pretty similar. And so I think we should go over those so you know what's you're dealing with if you have a patient like this. So cats that get an upper respiratory infection tend to get what you would call a runny nose, nasal discharge. Sometimes it's clear, sometimes it's green or yellow, and sometimes it can cause difficulty breathing because they have such small nostrils. A little bit of obstruction from mucus can actually cause some issues. The other thing cats like to get with an upper respiratory infection is they get some eye involvement, what we would call conjunctivitis, pink eye in humans. It's just an infection of the eye. It can be one or both eyes. And often you'll see similar things as you would with the nose. Discharge, it can be clear, white, yellow, or green. Sometimes they'll kind of start to keep their eyes closed, one or both of them. The eyes may look red. Sometimes even their little third eyelid, which is their extra eyelid that we don't have. It's attached at the bottom, and it'll kind of come up and cover the eye. And so all of these are really common symptoms of upper respiratory infection. The other thing you should know is that these infections tend to be contagious. So one of the things I recommend to clients all the time is that when they're bringing a new pet into their house, a cat, especially if they found it outside or recently adopted, they may want to consider quarantining this pet in a separate room, bathroom, for probably 2 weeks, just to make sure that their new pet's not going to get sick and that it's not going to spread it to everybody in the house. Now, luckily, these viruses, which is what they usually are, don't tend to be contagious to humans. So you don't really have to worry about that part. But you do want to make sure you're washing your hands, maybe even checking your clothes if you're going to be in with your new cat, and then also with the rest of your pets. Some things you can do at home to help your pets when they're having an upper respiratory infection is, like, I don't recommend giving medications like over-the-counter medications, but I do recommend putting them in a bathroom with like a hot shower running. That can really help with the congestion. And it's one of those things that's not going to do any harm, but may actually make a big difference to their quality of life while their body's trying to fight off the virus. And in more severe circumstances, we do recommend coming in for a veterinary appointment. Sometimes we'll prescribe antibiotics or antivirals. A lot of times the conjunctivitis problems will need some topical medications. And you especially want to bring your pet in if they're acting sick. What I mean by that is they are acting lethargic, if they're hiding in weird places, decreased appetite, and especially things like vomiting, diarrhea. Those are really big triggers. You're not going to want to wait a week on those. You're going to want to call your vet or Flagler Animal Hospital. We'll get you in same day for things like that so we can intervene quickly.
Yeah, I always worry with the lack of appetite, and if they're not eating and drinking, then stuff's going to go
Those
south.
are real red flags. Yeah. Especially for me, it's a change in their routine. We all know our pets, they get excited when we come home. They get the zoomies at dinner time. They all have their little quirks and regular activities. And if those start to change, that's a real red flag for me as a veterinarian. Like that's when I'm going to tell you, yeah, it's time to come on in.
Yeah, or like with cats, if they don't groom themselves as
Oh,
much.
that's a big one. Yeah.
Cats are so clean normally. They get sloppy and they don't feel good.
They're suddenly stop using the litter box.
Yeah.
That's a big one. Yeah.
Yeah. So I'm so, appreciate you reminding people what to look for. Do you very often, like I know at the shelter, sometimes when we have cats with upper respiratory, we'll use like the appetite stimulants.
Yeah, if they're not eating. For cats especially, smell is such a critical part of triggering an appetite. They don't even know necessarily that something is food if it doesn't smell like food. And so when their nose is super congested, that sense of smell is really decreased. And so sometimes we'll use medicinal appetite stimulants, and those can be very effective. Another thing I'll have clients do is, especially with wet food, I'll have you microwave
Warm
it.
it.
Yep, for just a couple seconds. We don't want it too hot, but we just want it stinky. If it's real stinky, they're more inclined to eat it typically.
And your whole microwave stinks after.
Yeah, your whole house.
But if it gets the cat to eat, then that's what we want.
Yep, then we can sleep at night.
Yeah. So, with now, obviously, we want everybody to vaccinate their cats. So
Yes.
with the
please.
So, what do you think as far as with vaccines? Like I know one of the vaccines is for Khaleesi and some of the more severe upper respiratory, but some of the just plain old run-of-the-mill upper respiratory infections don't even, you can't really vaccinate ahead of time.
We can't
to stop.
vaccinate for all million of the potential viruses that are out there, unfortunately. But vaccination is so important because the vaccines that we use are formulated specifically for viruses and bacterial infections that are very common and that we can protect against.
Yes.
So why wouldn't we?
Yes.
You know what I mean?
So everybody, please
vaccinate your cats.
Yes. All right. Well, we're going to take another quick break. We'll be right back. Welcome back to Speaking of Animals. I have a couple of upcoming events I wanted to tell you about. The soonest one we have coming up is Coffee with the Cats. Again, back by popular demand. We did a Coffee with the Cats last month, and 17 cats were adopted that afternoon.
Oh, that's amazing.
Isn't that awesome?
Yeah.
And then 5 dogs snuck in there too, and with all the extra traffic, in the shelter,
well.
so 5 dogs got adopted, and then a couple cats got adopted the following day that had been seen during the Coffee with the Cats. So we're going to do another Coffee with the Cats. Cat Daddy Jeff, who we all know.
He's a regular at Flagler Animal Hospital.
Yes, he's sponsoring again. We're just, it's just coffee and juice and snacks and,
And cats.
donuts and cats. What,
What more could you ask for?
Yeah, so we're going to have 50% off of feline adoptions that day, and we'll have some, like raffles, and we'll make it fun. But a lot of the cats, the friendly ones, we can just kind of let hang out in the education room and hang out with people while they're drinking coffee and socializing with other cat-minded people.
Will Spencer be there?
Unless Spencer goes home or is adopted first, he'll be there.
Yeah, I'll come to see him.
I bet you he's going to go home before that, but maybe. So we'll see. But that's September 28th from 1 to 4 p.m. No cost to come in or anything. No admission. Just come hang out with the cats and drink coffee and have snacks and stuff with us. So September 28th. Put that on your calendar. Come visit with the cats. A couple other things we have coming up. We're going to have the wreath event again this year at the Windsor Assisted Living. It's such a cool fundraiser. They do all the work, the folks at the assisted living, and we just have crafty people that make gorgeous, unique wreaths.
Are they still accepting wreaths?
Oh yes,
I
yes.
crochet, so
Oh, no, yes, cool. Please, yes. So at this point, it is early enough. We're looking for crafty people to make beautiful, unique wreaths or table settings. Christmas type decorations. The wreaths don't have to be Christmassy, but most of them are. But then at the event itself, which is the second Sunday in December, I believe. or maybe it's December 7th or 8th, whatever the. So the event itself, there'll be a silent auction that day. And it's a really nice event. The wreaths are all up on the residence doors, and you just, and again, there's food involved, of course. So yeah, it's fun an event to get you in the Christmas spirit. They have music and stuff. So
And it's for a good cause.
it benefits us. That's a very good cause. So yes, so crafty people, think about making wreaths and donating to the Windsor Assisted Living or to Flagler Humane Society for the wreath event. So yeah, those are a couple fun things we've got coming up. Dr. Whalen, I wanted to thank you so much for being here today. A wealth of information. I think
It was fun.
Yeah, we all learned a little bit more about diabetes and upper respiratory infections and all that fun stuff. But hopefully everybody stays healthy so they don't come see you.
I say that all the time. I hope I don't see you in a while.
Phone number if anybody needs to come see you at Flagler Animal Hospital, 439-1606, right?
Yep, that's it.
Or just come see you. I really appreciate you guys being available for emergencies.
Yeah. Call us anytime during open hours.
Awesome. Well, thank you so much for being on the show today. Thank you, Scooter, for being a wonderful guest also. And thank you, everybody, for listening. Take care. Bye-bye.
Bye.